Dominique Wallace, and today we will be doing trach care. Okay, before I do trach care, I check the patient's chart to see if it's any abnormal values or anything that affects um, when I'm doing trach care for the patient. And usually trach care is PRN or every shift or as needed, PRN as needed. But I go into the room. Today we have Mr. Jones. I go into the room. Hello, Mr. Jones. My name is Dominique Wallace. I'm from Respiratory Therapy, and today I will be doing your trach care. Make sure it's Mr. Jones. Check his arm. It's Mr. Jones. Okay. I check the SAT. I listen for breath sounds to see if he needs suction. I check his stats, his heart rate, his respiratory rate, see how he's doing like physically. And sometimes you want to check to see if he needs suction, because if you don't do suction and he needs it, and you cleaned him already, and he coughed and all that stuff come out, now you have to do another procedure of cleaning it. So check everything. Everything seems fine. Then I decide to do the trach care. Let him know what I'm doing. Alright, Mr. Jones, this should not take that long. I put on my regular gloves first. Make sure it's usually smaller than your actual glove size, because you have to put sterile gloves on top. I have my regular gloves. Yes, it's going to be tight, but I have my regular gloves. Then I get my sterile gloves out, which is usually labeled left and right. Make sure you put them on correctly. All the way down, all the way down. Put my right one's on. Alright. Then I try to touch the outside of it so you can keep this area sterile. And then this is all the stuff that belongs in the trach care kit. Remember, my hands are still sterile. We have 4x4 gauze. We have Q-tips, pipe brush, pipe clean, pipes for the inside to dry it, and you have a tie to tie it. What I do, I have I'm gonna put peroxide and water mix. I'm gonna put them in 2 different compartments. What I do, for the big one, I put that one for the inner cannula, and the other one I put for the Q-tips. So I put my solution in, make sure it's sterile water, not out the faucet, sterile water. So this is my solution area. Now what I'm going to do, take the inner cannula, unlock it, take it out, put it in peroxide water solution, sterile water solution. Remove this gauze, and make sure you remove it slowly, because sometimes it's sticky, have blood or secretions or something on it, and if it's sticky or whatever, then it might be stuck to the skin, and you have to get a Q-tip to unloosen it or whatever. But I leave that over there. Then I come back, take my brush, and clean the inner cannula. Make sure you get all the gook out. You have sterile gloves on, so don't be cute. Clean it accurately, please. All the way in, under, inside. have my sterile water to rinse it off. Get my pipes to dry it in the inside. My gauze to dry the outside. Then I put it back in. And don't force it, because you might can damage. It should just go easily in. You should hear a click. If you don't hear a click, make sure the two lines are side by side. They're lined up. Both the lines are lined up. So I get my Q-tips that's was in the peroxide water solution and clean this area. All you need is one swipe. Swipe up one time. Clean as much as possible. And use it once. Use one Q-tip at a time and don't reuse it. And I don't see anything, so I'm going to put my other gauze on, which should have a slit in it. And if you can see, it has a slit in it. And then I'm going to change the ties. And once you change the tie, make sure you have one hand on the flange, so just in case if the patient cough, it won't come out. And then all the doctors be mad at you and tell them to get off your floor. Professional RTs in the making. You doing okay, Mr. Jones? Yes. See? Talk to your patient. It's okay. They don't bite. And now I have my clean tie. Sometimes a patient will assist you. Depends if the patient is sedated or not, or is okay. Sometimes that will help you too. And it's okay. Don't be afraid to talk to your patient. Mr. Jones, can you lift up for me? Mr. Jones, lift up. Go behind his head. Still have one hand on the flange. And what I'm checking is to see if I have two fingers that can go through when I tie it, because I don't want to tie it too tight, because if I tie it too tight, I have a ring around the patient's neck and causing further injury, which I don't want to do. Alright, two fingers. Your beeper going off, Mr. Jones. Alright, check two fingers on this side. I can have two fingers. Make sure this is smooth. It's smooth. Then after that, I want to go over, check his breath sounds, his saturation, and to see how he's doing, how he's feeling or anything, and let him know that I'll be back in here to check on him and all this other stuff. But the normal stuff: heart rate, respiratory rate, sat, use capnography, and all the other stuff. And then 3 complications that can occur: you can get a pneumothorax, You can have subcutaneous emphysema. You can have hemorrhage for the incision. They use a obturator in order to not damage the mucosal layer when they insert in the trachea. Make sure it don't go all the way down, or to damage the mucosal layer. And that is how you do trach care for a patient. But they also have regular different trachs. They have speaking valves or whatever, which is a passageway, which a patient can have a trach, and you can talk while they have a trach inside. And that's it. Thank you.